Before we start, let's get a look on the anatomy of gallbladder. This is called left hepatic duct, and this is called right hepatic duct. This part is called common hepatic duct. This part from here to here is called cystic duct. And this is the gallbladder. This part from here to here is called common bile duct. If obstruction occurred here with inflammation to gallbladder, it is called cholecystitis. It is inflammation to obstructed gallbladder. But if obstruction occurred here in this part, mostly here, and inflammation occurred, it is called cholangitis, inflammation to the common bile duct. Cholecystitis, it is inflammation to obstructed gallbladder. It may be acute or chronic. Whatever it is acute or chronic, it is related to gallstones. Obstruction caused by gallstones lead to concentration of the bile, and this will make an irritation, leading to inflammations and irritation of nerves here, leading to pain. Also, obstruction will lead to stasis of the bile, and this will help the bacteria to grow, especially E. coli bacteria. Obstruction leads to concentration of the bile, and this will make chemical irritations. Bacterial infections due to stasis of the bile. Reflux following back of pancreatic enzymes if there is obstruction in sphincter of OD. Here in the gross pictures, you can see dilated lumen leading to swollen gallbladder. Hyperemic surface due to inflammations. The surface also is covered by fibrinous exudate due to fibrinous inflammations. Perforation as a result of rupture of gallbladder will lead to localized abscess if there is fibrinous adhesions, but if there is no fibrinous adhesions, it will lead to peritonitis associated with tenderness. Microscopically, the walls will become edematous and congested due to the inflammations and infiltrated with polymorphs, mostly neutrophils if there is suppurative one. Types of acute cholecystitis. Here in number 1 and 2, cataro and suppurative one, we'll talk about severity. It is mild in the cataro type and more severe if there is suppurative inflammations. The wall here will be glistening بمعنى brighted wall in cataro cholecystitis. But here there is separation of the wall. The lumen here it is dilated, and also here it is dilated. But here it is dilated by clear water fluid, mucus, and here it is dilated by pus. The condition here called hydrops of gallbladder, but here called empyema. Empyema means accumulations of pus. So it is called empyema of gallbladder, collection of pus in closed sac. Gangrenous, and it is a rare type because the gallbladder has a rich blood supply. The second type is called chronic cholecystitis. It is associated with long-standing colitis. It is very common disease, especially in 4F, female, fertile, fatty, 40. Remember that by 4F. Occurs on top of acute cholecystitis or start as chronic. Let me explain to you what happens in chronic cholecystitis. In chronic cholecystitis, obstructions occur. Then symptoms start: pain, nausea, vomiting. Then obstruction removed by dislodging of the stones and passing it to the interior circulations. And the symptoms will be relieved. Then obstruction occurs again and the symptoms start. Then obstruction removed and symptoms will be relieved by passing the stone to interior circulations. Then obstruction occurs again and again. This state is called chronic cholecystitis. Grossly, you can see normal gallbladder in size or contracted or dilated. The wall will be thickened, maybe due to muscular hypertrophy, fibrosed and opaque. Gallstones always present, as we have mentioned above, atrophy of mucosa. The surface, due to fibrosis, it is covered by adhesions. Adhesions with liver or intestine, and if it is occurred with intestine, it may lead to fistula. By microscope, you can see squamous metaplasia due to chronic irritation to the mucosa, chronic non-specific inflammations, which are mononuclear cells, lymphocytes, plasma cells, macrophages, and fibrosis of all layers. Dystrophic calcifications, it is called porcelain gallbladders. It means that the wall of gallbladders becomes calcified. It is seen in X-rays, and if it is seen, the gallbladder should be removed surgically. The mucosa will become thickened, edematous due to the inflammations. Sometimes the mucosa proliferate and invaginates the deeper layers, leading to Rokitansky-Ashov sinuses. It is one of the hallmarks of chronic cholecystitis. It means herniations of gallbladder mucosa to the muscular wall.